A local health center is keeping its doors open to offer services to our community.
Elizabeth Alvarez is live in Bankers Hill with the details. What is going on here, Liz?
Well, we're having a little, it looks like some sort of a wellness, fitness, yoga session here inside one of the rooms at the American Indian Health Clinic here in Bankers Hill. There is a fitness instructor, and this class, by the way, not only for patients who right now are at home, because this is all being done telehealth, we've also got staff that are getting the opportunity to also get fit and stay well. And staying well is the name of the game here at this community clinic, nonprofit that's been around for a while, and even more so now is meeting the needs of so many in the community. This morning we've been chatting with Kevin LaChapelle, who is the interim CEO of the center, and he's here to talk about why this clinic has become such a safety net, especially during the COVID-19 pandemic. Tell me about that, Kevin.
Well, you know, this has been around for over 40 years, and there's many programs here. So you got your behavioral health, medical, and dental, and then you also have many grants for well-briety, addiction treatment, all sorts of things. But since COVID happened, we've had to really adapt, as healthcare has across the country, and community clinics especially. And so telehealth, which we had a platform already available, so we were fortunate with that. But now we've been able to say, well, let's do teletherapy, let's do telehealth visits, even dental, where they can call in, and then here for our tele-wellness program. And because we've heard people, some of our patients are saying, hey, I'm putting on a little bit of weight because I'm staying home, I'm concerned about this, and this is a way for reducing stress and also for interacting with other people rather than being so isolated. So it's been a real big hit.
Yeah. And, you know, I wanted to ask you also, as I stay off camera, you know, we've noticed, and you have noticed, your staff has been telling you that there has been a lot of people coming in, whether with appointments or without appointments, really concerned over what's happening. Have you noticed that therapy sessions have increased because of that?
We've had a real big increase in our behavioral health for the teletherapy appointments, and from depression to anxiety, people just concerned, but also sometimes there's relapse issues with addictions and things like that as well because of the stress of COVID, which this country, the world has never seen something like this. So imagine what this does to an individual, and we want to meet people where they are, meet them where they are, whether it's public health nurse going out to their home or meeting them and helping them adjust to this new digital environment with telehealth.
And who is the health center for? Who can come here?
So our health center, we specialize in Native American care. We use those modalities from drumming circles and all sorts of just amazing, incredible things. But we serve everybody in the community. So we generally provide help for people, especially low income, and people that have unique needs. And so we're always here to engage with all of our patients, all of them from the community.
Thank you so much, Ken, for sharing that with us and allowing us to capture how this is working and how patients are still getting to be seen by the medical professionals, health professionals, and mental health professionals as well. And of course, as we showed you earlier this morning, the first thing that patients do, whether you have an appointment or you don't, is you go to the parking lot, and there is a white tent that is set up there, and that is where you will actually have your temperature taken. They will screen you to make sure that you're not exhibiting symptoms, COVID-19 symptoms specifically. And if you do show that you are having symptoms, they will actually test you for COVID-19. According to Dr. Saw, there are tests being administered for the coronavirus. So that's what's happening here. We're at the American Indian Health Center right on the corner of First Avenue and Maple, a very busy place, especially during this time. We'll send things back to you for now.
All right. Doing what they can. Thanks, Liz. Appreciate it.
Thank you, Elizabeth.